Today I'm going to be discussing case study number 47, Kenyan fishermen. So, Bashir is a 36-year-old Somalian male who has just immigrated to New York from a refugee camp in Kenya. He's experiencing episodic gross hematuria, and upon hospital admission, he remarks that he is experiencing severe abdominal pain along with his bloody urine. When discussing his travel, he remarks that he was a fisherman in Somalia when he traveled to a Kenyan refugee camp where he was a freshwater fisherman. 10 weeks ago, he made his way to the US and settled in New York. So my patient is presenting with abdominal pain as well as blood in the urine. So based off of those signs and symptoms, for question 1, the syndrome, I have suspected schistosomiasis or a bladder infection UTI. Based on his travel history and the what the patient is presenting with, those are likely syndromes that could be infecting my patient, and those are the two that I focus on. So for question 2, the differential diagnosis, the causes of both schistosomiasis and a urinary tract infection. In the bacterial section, I'm looking for E. coli. There are not any fungal or viral infections that I'm looking for in my patient, since neither of those are suspected. And for the parasitic, I'm looking at Schistosoma hematobium. So for E. coli, I'm looking, or for the bacterial, I'm looking for E. coli due to the fact that I'm suspecting a urinary tract infection. And for the Schistosoma hematobium, I'm looking at that for the schistosoma antigen for schistosomiasis. So schistosoma hematobium is a likely suspect for my patient since he did travel to Kenya, and that is a area in the world that schistosomiasis is possible. And he was fishing in fresh water there, which is where this infection is usually contracted. So my patient could have contracted this disease when he was in the water, and based on the timeline of his symptoms being presented, it does line up, and so the infectious microbes all line up with the symptoms that he has presented with. Since E. coli is a common bacteria, and it is the most common type of bacteria to cause cystitis or urinary tract infection, this is also a very likely suspect, and that's why I'm continuing to look into that. So for questions 3 through 6, I'm looking at sample request form, and I'm looking at antigen detection for schistosomiasis, as well as I have requested a blood and urine and blood and midstream urine sample to rule out any sort of E. coli or bacterial infection. And again, for the parasitic, I'm looking at schistosoma, and I'm looking at that antigen detection. So for the bacteriology lab, I'm looking at the blood and midstream urine samples, and the serology lab, I'm looking at the antigen detection. So for question 7, moving on, I'm looking at the results from the serology lab, and they ruled out bacterial cause. So there was no growth on any of the smears for the blood, and there was no growth on the midstream urine sample. So based on that, I can completely rule out a urinary tract infection or bladder infection as a possible syndrome that my patient is suffering from. For question 8, I looked at the results from the parasitology lab, and based on those results, I can say that my patient does have schistosomiasis because the antigen test for the detection of schisto was positive, and that was what I was looking to see when I ordered that lab test. So for question 8, the prognosis and treatment. The treatment for this, for schistosomiasis, I would prescribe my patient with praziquantel to treat the schisto antigens, and it's based on my research, this is an antimicrobial therapy that is used to treat schistosomiasis, and it is usually taken for 1 to 2 days, and it should treat the patient's parasitic infection completely. So my prognosis, because my patient is 36 years old and an otherwise healthy, based on the information that I was presented with, I feel that my patient should recover completely. In addition, this parasitic infection was caught in a timely manner where chronic disease is unlikely. So based on the patient's information I have been presented with, the prognosis for my patient is a full recovery. There are some instances where schistosomiasis can lead to chronic disease, but because of his otherwise healthy physical state, as well as the timely manner that he was came to receive help in, I feel that this is a treatable and he will make a full recovery from this syndrome. So that is it for my case study number 47, Kenyan fisherman. Thank you.